magnetic resonance imaging, MRI, or computed tomography, CT, scans create a three-dimensional image of your brain. These imaging procedures offer the most definitive method to determining which specific causes of cognitive impairment are causing memory loss, such as a stroke, brain tumor, or subdural hematoma, intracranial blood collection. Conditions in the brain can lead to neurological and cognitive problems. Correct treatment can enable recovery, mainly if the issues are found early. If necessary, an MRI or CT may be performed to rule out other possible causes of memory and thinking problems or to look for structural changes in certain parts of the brain that would indicate the possibility of Alzheimer's disease or other neurological disorders. An amyloid PET scan is a brain scan that can identify amyloid plaques using one of two telltale signs of Alzheimer's disease in the brain. However, it is also insufficient on its own to diagnose Alzheimer's. The FDA has approved the use of amyloid PET scanning. However, it is still not covered through Medicare or private health insurance. More acetylcholine is available in the brain. Donepezil and rivastigmine have been approved for mild, moderate, or severe Alzheimer's disease, whereas galantamine is for soft to medium. Although insufficient data support that any cholinesterase inhibitor drugs prevent the development of dementia in people with MCI, side effects can usually include gastrointestinal problems such as dyspepsia and diarrhea. Memantine, Namenda, is FDA approved for treating moderate to severe Alzheimer's disease. It is an NMDA receptor antagonist, which prevents glutamate, a neurotransmitter transmission blocker, from attaching to NMDA receptors in the brain. Excessive glutamate stimulating these receptors can damage neurons and synapses. Memory loss and trouble with other brain functions can result when the leading cause is diagnosed and treated. It most frequently takes place as a result of treating another condition, such as depression or thyrotoxicosis, or stopping a medication like diphenhydramine, Benadryl. There is no medication to treat age-related memory loss. For Alzheimer's, FDA-approved prescription medications have existed for 20 years, but they are not a cure for the condition. They improve some memory functions and daily functions, but they can provide only suboptimal improvements in others. In June of 2021, the Food and Drug Administration approved aducanumab, Aduhelm, to differentiate a person with mild cognitive impairment or dementia caused by Alzheimer's disease from others. However, the drug has been highly controversial. Cholinesterase inhibitors are medications that keep the levels of acetylcholine high in the brain, which is necessary for memory and learning. The cholinesterase inhibitors work by chilling an enzyme that breaks down acetylcholine, possibly increasing tiredness the following day from taking the drug. Eventually, you may find that you can no longer handle every issue independently, and you will ultimately need to hire an authority. You'll need a legal authority called a durable power of attorney, which is typically the best way to grant someone else the decision-making authority on your behalf. It also enables you to designate someone who can take care of money and expenses for you. A separate document known as a healthcare power of attorney allows someone to take charge of your medical care in circumstances where you cannot do so yourself. A healthcare power of attorney and an up-to-date will are the perfect things to do if you have been diagnosed with something. Matthew, the video creator, 83-year-old cancer/stroke survivor who received his Ph.D. at 65, would like you to know his